to Our Daily Chews, your go-to podcast for all things nutrition. I'm Lynn Clayton, a registered dietitian, nutritionist, and your host. I help you sort fact from fiction with a research-based and common sense approach to nutrition science. Today, we're going to tackle a common digestive issue that many people face but may not openly talk about: constipation. About 4 million people in the United States have frequent constipation. It is the most common gastrointestinal complaint, resulting in 2.5 million doctor visits annually. Let's explore what constipation is, what causes it, natural ways to manage it, and pharmaceutical treatments to add if necessary. Some people may be living with chronic constipation and not even realize it. If your bowel habits have been the same for years, you may think that's normal. And even if other people experience different bowel habits, you may think yours is normal for you. Well, first, let's define constipation. According to the National Institute of Diabetes and Digestive and Kidney Diseases, constipation is a condition in which a person has infrequent bowel movements or difficulty passing stools that persist for several weeks or longer. Typically, having fewer than 3 bowel movements a week indicates constipation. Ideally, it's best to have 1 to 2 bowel movements daily. This helps eliminate waste and avoids toxins being reabsorbed through your colon. Chronic constipation can also increase the development of hemorrhoids. Not pleasant. So, what causes constipation? The causes of constipation can vary greatly, but here are 8 common factors associated with constipation. First is inadequate hydration. Not drinking enough water can lead to hard, dry stools, making them difficult to pass. Another thing is sedentary lifestyle. A lack of physical activity can slow down the movement of food through the digestive tract. And a lack of fiber. A diet low in fiber is a common cause of constipation. Fiber helps to bulk the stool and make it easier to pass. Aim for at least 25 to 30 grams of fiber per day from sources like fruits, vegetables, whole grains, and legumes. And ignoring the urge or holding in bowel movements can lead to constipation. On the opposite end, abusing laxatives. Using laxatives frequently can result in dependency on them, creating a vicious cycle of constipation once the laxatives are stopped. And underlying health conditions such as irritable bowel syndrome or IBS, diabetes, hypothyroidism, and neurological disorders can contribute to constipation. Pregnancy also increases the risk. Constipation incidence also increases with age. Any problem with intestinal function may result in constipation. And also changes in routine, traveling, changes in your diet, changes in your routine or altered sleep patterns can affect bowel habits. And you may notice this when you go on vacation. Another common cause of constipation is medication. Here are 8 medications reporting constipation as a common side effect. These include opioid pain medications, such as morphine, oxycodone, and tramadol, to name a few. These analgesics help alleviate pain, but they also slow down your system, including your GI tract, making it harder to poop. Tricyclic antidepressants like amitriptyline, also known as Alleviate, can cause constipation due to its anticholinergic effect, which blocks a chemical called acetylcholine. This slows down your intestines. This can be a desirable effect if you suffer from diarrhea, but not so great if you're already constipated. And nonsteroidal anti-inflammatory drugs like ibuprofen and naproxen, especially if taken in high doses or for extended periods of time, can contribute to constipation. Using the lowest effective dose and limiting how often you take these medications can help. Another drug you may not think about being related to constipation is antihistamines. These medications, such as diphenhydramine, also known as Benadryl, have anticholinergic effects similar to tricyclic antidepressants, which slow down the intestines. They also tend to dry you out. If you have allergies, fortunately, the newer generation antihistamines like loratadine or Claritin, fexofenadine, Allegra, are less likely to cause constipation. Antihistamines can be used for more than just treating allergies, however. A different group of antihistamines are used to manage heartburn symptoms. These histamine 2 receptor antagonists or H2 antagonists include medications like famotidine, Pepcid, or cimetidine, Tagamet, which can cause constipation. And blood pressure medications. Even though medications to lower blood pressure can be vitally important and greatly reduce the risk of stroke or heart disease, they're not without side effects, including constipation. Not all blood pressure medications work the same way, however. Some classes of blood pressure medications, like calcium channel blockers and beta blockers, are more likely to cause constipation. The blood pressure medications most often linked to constipations includes amlodipine, also known as Norvasc, diltiazem, also known as cardizem, verapamil, propranolol, and clonidine. If you're taking blood pressure medication and struggle with constipation, talk to your doctor for treatment options. And antiemetics, also known as anti-nausea medications, are linked to constipation. These are typically prescribed to prevent nausea and vomiting after surgery or chemotherapy, but they may also be used to treat other causes as well. One common nausea medication, known as Zofran, may cause constipation, especially with long-term use. Promethazine, also known as Phenergan, can cause constipation too, but technically it's an antihistamine. And medications to relieve symptoms of overactive bladder, including oxybutyrate and tolterodine, also known as Detrol. These anticholinergic medications help treat overactive bladder by reducing muscle spasm in the urinary tract, which can contribute to constipation, especially if you take them regularly. And then we can't forget about our GLP-1 medications like semaglutide, Ozempic, or Wegovy, or Rybelsus, and liraglutide, also known as Victoza or Saxenda. And these are used to treat diabetes or for weight loss, but these can contribute to constipation because they slow down the digestive tract. And then one commonly prescribed nutritional supplement is notorious for causing constipation. And I'm talking about iron. Supplements like ferrous sulfate or ferrous gluconate used to treat iron deficiency anemia can cause constipation and make your stool look darker than normal. Iron may also be present in some multivitamin or mineral supplements. Other supplements containing certain forms of calcium or antacids containing calcium, such as Tums or aluminum containing antacids, can contribute to constipation as well. Taking supplemental magnesium along with calcium can help to alleviate constipation. Magnesium is a natural laxative that relaxes intestinal muscles and helps rehydrate dry feces, making elimination much easier. So, what are the symptoms of constipation? Each individual may experience different symptoms, but the most common symptoms of constipation may include fewer than 3 bowel movements a week, difficult or painful bowel movements, feeling bloated or uncomfortable, feeling tired or sluggish, or having abdominal pain. If you're experiencing symptoms but aren't sure constipation is the problem, your doctor may do some tests. The simplest way is to start with a complete medical history, including a list of medications, past surgeries, and symptoms. To rule out other concerns, your doctor may perform an anal exam, and if needed, an abdominal x ray may be ordered to see if stool is detected in the colon. Depending on the results, other tests may be ordered, including a colonoscopy to rule out any anatomical issues or diseases affecting the colon. If you're dealing with constipation, fortunately, there are several natural remedies you can try. Here are my top 6 recommendations. First is increase fiber. Aim to include more high fiber foods in your diet, such as fruits, vegetables, whole grains, and legumes. And secondly, stay hydrated. Drink plenty of water throughout the day to help soften the stool and facilitate bowel movements. And exercise. Regular physical activity can help stimulate the digestive system and promote regular bowel movements. And establish a routine. Try to use the restroom at the same time every day to train your body to expect regular bowel movements. And natural laxatives. Prunes and prune juice contain natural laxative properties and can help relieve constipation. Probiotics. Certain probiotics may support gut health and regular bowel movements. Fermented foods naturally provide probiotics, and supplements are available if needed. Discuss which type of probiotic may be beneficial with your dietitian or healthcare provider. If natural remedies aren't providing relief, you may need to consider over the counter or prescription medications. Let's look at a few. Let's talk about laxatives first. We have three different types. There are bulk forming laxatives, and these are over the counter medications like psyllium husk and methylcellulose that add bulk to the stool, making it easier to pass. And then we have osmotic laxatives. These work by drawing water into the colon to soften the stool, and examples include polyethylene glycol, also known as Miralax, and magnesium hydroxide, known as milk and magnesia. And then we have stimulant laxatives. These stimulate the muscles in the intestines to move the stool through more quickly. Senna and bisacodyl are examples of this. And then we have stool softeners. Docusate sodium can help soften the stool and make it easier to pass. We also have suppositories and enemas, which can provide quick relief in certain cases. And if over-the-counter options aren't effective, your doctor may prescribe medications such as Amitiza or Linzess, which increase fluid secretion in the intestines and stimulates motility. But always consult your healthcare provider before starting any new medication, especially if you have any underlying health conditions or are taking other medications. Remember, constipation can be uncomfortable, but it is manageable. By understanding causes and making a few lifestyle adjustments and seeking the appropriate medical help if needed, you can maintain good digestive health. That's it for today's episode of Our Daily Chews. Thanks for listening. If you enjoyed this episode, make sure to subscribe and leave us a review. Until next time, eat well and be healthy. This podcast is sponsored by Clayton Nutrition, a private medical nutrition therapy practice offering telehealth services for those needing nutrition therapy to prevent, treat, or manage chronic health issues. Whether it's diabetes, cardiovascular concerns, food allergies, digestive issues, or weight management, we focus on good nutrition for better health. Check out my resources, blog articles, and one-to-one nutrition services at claytonnutrition.com. And Clayton Nutrition is offering Better Diabetes Control, a 6-video module course covering everything you need to know about managing diabetes. Get your diabetes questions answered in this self-paced course. It includes a booklet and resources to guide you. Go to claytonnutrition.com/nutrition-courses to learn more and sign up to get started. Clayton Nutrition also offers an online course called A Better Way to Better Health. This 8-module video course is packed with resources to help you along your weight loss journey. Check it out at claytonnutrition.com/nutrition-courses for more information and to sign up. This podcast is for educational purposes only and is not intended to replace the advice of your healthcare professional. I recommend you seek help from a trained professional who can work with you in your specific situation.